What is a brain lesion on an MRI scan? Imagine looking at a detailed map of the brain and noticing spots or patches that don't quite match the surrounding tissue. These spots are what doctors call brain lesions. On an MRI scan, a brain lesion appears as a dark or light area that stands out from normal brain tissue. These lesions are signs of some kind of change or damage in the brain tissue, caused by injury, disease, or other factors. MRI scans are especially good at showing these abnormalities because they produce detailed images of the brain's structure. When radiologists examine an MRI, they look for any unusual spots that could indicate a problem. Lesions can be tiny or quite large, and their appearance can give clues about what might be causing them. For example, some lesions look different depending on whether they are active or old, which helps doctors understand the current state of the disease or injury. There are many reasons why a brain lesion might show up on an MRI. Common causes include stroke, which happens when blood flow is blocked or reduced, leading to tissue damage. Brain tumors, whether benign or malignant, can also appear as lesions. Multiple sclerosis, a disease where the immune system attacks the nervous system, often causes lesions that look like small patches of damage. Other causes include traumatic brain injuries, infections like encephalitis, brain aneurysms, abnormal blood vessel formations called arteriovenous malformations, epilepsy, and even age-related changes like small vessel disease. It's important to remember that not every lesion found on an MRI means there is a serious problem. Sometimes lesions are discovered by chance during scans for other reasons, and they may not be related to any symptoms. For example, many people over the age of 60 have small white matter changes that are considered normal for their age. When a lesion is found, doctors carefully analyze its size, shape, and location. Sometimes, they use special contrast dyes like gadolinium to see if the lesion is active or inactive, which helps in understanding if there's ongoing inflammation or damage. The significance of a brain lesion depends on many factors. Some lesions are minor and may heal on their own or with treatment, while others can be more serious and requiring ongoing medical care. If a lesion looks potentially concerning, doctors may recommend additional tests or follow-up scans to monitor changes over time. Consulting a neurologist can help determine the cause and the best course of action. From a brain health perspective, understanding what a lesion represents is key to proper diagnosis and treatment planning. Modern imaging techniques have greatly improved the ability to detect and analyze these lesions, leading to better outcomes for many conditions. Remember, every brain is unique, and the presence of a lesion does not automatically mean there is a severe problem. If you or someone you know has concerns about brain lesions or MRI findings, it's essential to speak with a healthcare professional who can interpret these results in the context of individual health and symptoms.